and is called A. Aspermia, B. Azoospermia, C. Asthenospermia, D. Tetrazoospermia. Correct option is A. Aspermia. 2. In Weber's test, lateralization of sound to diseased ear indicates A. Conductive deafness, B. Sensorineural deafness, C. Tympanic deafness, D. Combination of both sensorineural deafness and conductive deafness. Correct option is A. Conductive deafness. 3. Which artery is commonly affected during myocardial infarction? Am I A. Renal artery, B. Celiac artery, C. Coronary artery, D. Hepatic artery. Correct option is C. Coronary artery. 4. What is the main sign of the tuberculosis? A. Coughing more than 3 weeks, B. Coughing occasionally, C. Coughing only at night time, D. Mild coughing. Correct option is A. Coughing more than 3 weeks. 5. The goal of clinical management of a patient with COPD is A. Improvement in ventilation, B. Increase in bronchial secretions, C. Improvement in general health, D. All of the above. Correct option is D. All of the above. 6. Liver abscess mainly occurs in A. Right lobe of the liver, B. Left lobe of the liver, C. Both lobes, D. None of the above. Correct option is A. Right lobe of the liver. 7. In which of the following disease conditions glucocorticoid therapy is applicable? A. Chronic adrenal insufficiency, B. Bronchial asthma, C. Preventing graft rejection in organ transplantation, D. All of the above. Correct option is D. All of the above. 8. The most useful test for the diagnosis of diabetes mellitus is A. Urine glucose, B. ESR, C. Glucose tolerance test, D. Ketone body level. Correct option is C. Glucose tolerance test. 9. A patient with cerebral thrombosis is scheduled for cerebral angiography. Which of the following nursing care is appropriate for this client? A. Inform the client that a warm, flushed feeling and a salty taste may occur. B. Avoid applying a pressure dressing over the site of puncture. C. Keep the extremity used as puncture site flexed to prevent bleeding. D. All the above. Correct option is A. Inform the client that a warm, flushed feeling and a salty taste may occur. 10. What does male intersex mean? A. Presence of female external genitalia with male gonads. B. Presence of male external genitalia with female gonads. C. A man having sexual relation with another man. D. A man having sexual relation with a woman. Correct option is A. Presence of female external genitalia with male gonads. 11. What is the main reason for angina pectoris? A. Neurological disease, B. Gastric disease, C. Respiratory disease, D. Cardiac disease. Correct option is D. Cardiac disease. 12. What does cystoscopy mean? A. Accumulation of fluid in the urinary bladder, B. Bladder sloughing, C. Bladder infection, D. Having bladder atrophy. Correct option is B. Bladder sloughing. 13. Side effects of long-term glucocorticoid therapy are A. Peptic ulcer, B. Sensitivity to infection, C. Cataract and glaucoma. D. All of the above. Correct option is D. All of the above. 14. Cholelithiasis is A. Inflammation of gallbladder. B. Stone in kidney. C. Stone in gallbladder. D. Infection in kidney. Correct option is C. Stone in gallbladder. 15. Which is the best test for detecting liver dysfunction? A. Serum albumin. B. Serum bilirubin. C. SGPT. D. Prothrombin time. Correct option is A. Serum albumin. 16. Which of the following is a bone disease that causes loss of bone density and increases the risk of fractures? A. Osteoporosis. B. Hyperglycemia. C. Glycemias. D. Emphysema. Correct option is A. Osteoporosis. 17. Dyspepsia. A. Small amount of acid secreted in the stomach. B. Acid is secreted in excess in the stomach. C. No relation to acid secretion in stomach. D. None of the above. Correct option is B. Acid is secreted in excess in the stomach. 18. The reason why lipstick and nail polish is removed before surgery is A. Surgery becomes easier. B. Surgery becomes more successful. C. Psychological benefits to the patient. D. Cyanosis is checked. Correct option is D. Cyanosis is checked. 19. Glucocorticoid therapy should not be stopped suddenly because A. Sudden discontinuation may result in serious mental disorder. B. Sudden discontinuation may cause allergic. C. Sudden discontinuation may cause severe adrenal insufficiency. D. None of the above. Vitamin deficiency. Correct option is B. Sudden discontinuation may cause allergic. 20. The nurse is caring for a male client with a diagnosis of chronic gastritis. The nurse monitors the client knowing that this client is at risk for which reactions and infections? A. Vitamin A. B. Vitamin B12. C. Vitamin C. D. Vitamin E. Correct option is C. Vitamin C. 21. Raynaud's disease is A. Nervous system disease. B. Digestive system disease. C. Heart circulatory disease. D. Respiratory diseases. Correct option is C. Heart circulatory disease. 22. The immunoglobulin that is found in breast milk is A. IgG. B. IgM. C. IgD. D. IgA. Correct option is D. IgA. 23. The trauma caused during myocardial infarction, MI, and dysrhythmias is A. Cardiogenic trauma. B. Hypovolemic trauma. C. Neurogenic trauma. D. Septic trauma. Correct option is A. Cardiogenic trauma. 24. The volume of urine in oliguria is A. Less than 100 milliliters. B. Less than 400 milliliters. C. Less than 800 milliliters. D. Does not make urine. Correct option is B. Less than 400 milliliters. 25. T-tube drainage is used after which surgery? A. Lobectomy. B. Billroth. C. Cholecystectomy. D. Ileostomy. Correct option is C. Cholecystectomy. 26. The cause of pneumonia in AIDS patient is A. Staphylococcus. B. Streptococcus. C. Pneumocystis carinii. D. Mycoplasma. Correct option is C. Pneumocystis carinii. 27. Presence of sugar in urine. A. Oliguria. B. Glycosuria. C. Hematuria. D. Puria. Correct option is B. Glycosuria. 28. What is the drug of choice for thalassemia? A. Vincristine. B. Vinblastin. C. Dilanthine. D. Diferoxamine. Correct option is D. Diferoxamine. 29. Cancer found in connective tissue is A. Carcinoma. B. Sarcoma. C. Leukemia. D. Metastasis. Correct option is B. Sarcoma. 30. Select the correct statement regarding the specific disorder of muscular or skeletal system. A. Osteoporosis, decrease in bone mass and higher chances of fractures with advancing age. B. Myasthenia gravis, an autoimmune disorder characterized by inflammation of the joints. C. Gout, inflammation of joints due to extra deposition of calcium. D. Age-related shortening of muscles. Correct option is A. Osteoporosis, decrease in bone mass and higher chances of fractures with advancing age. Thanks for watching. Now subscribe MCQS Hub.